very much for having me. It's a pleasure.
Yeah, it's good to. We haven't met face to face yet, but we've been talking online for a bit, so it's glad to talk with you.
Yeah, really cool. You.
Good. So maybe let's start off with like, what is biological dentistry and what does it do?
Yeah. So yeah, as I said, I'm a specialist in biological dentistry and ceramic implants. So in my opinion, biological dentistry is the overlap of functional medicine, you could say health optimization or biohacking, and high-tech dentistry. So it's basically the next level of conventional dentistry with the focus on optimal health. So how can I get my patients as healthy as possible? And as you know, health starts in your mouth because this is kind of like the entrance to your overall body.
Hmm. Right. Yeah, that is such a like underrated approach in a way that one of our most immediate point of contact is our mouth with the outside world, so to say that we do experience the world by touch, but the skin is like a very surface layer, whereas the mouth is more of like a direct point of contact with the outside world and the things that we may potentially come across. So that's very true.
Yeah, totally. Yeah, it's kind of like the entrance to your whole system. So basically, when we come to Earth, like through the womb, through the birth channel, our oral microbiome starts in the mouth, and by like getting the flora from your mom's vagina, and then it changes through breastfeeding, and then of course you have a whole microbiome in your mouth, which makes total sense because it's kind of like the initial contact to the outside world, your immune system, and it's all like living in there. It's quite bigger than the gut microbiome or the microbiome in the colon. Give me one second.
Hmm.
Yeah, yeah. Sorry,
No problem.
it's supposed to be a bed.
Yeah, yeah, no problem. Um, so how did you get into biological dentistry? Like, did you start off as one, or were you more of like a conventional dentist first?
Great question. Thank you very much for asking. Took me a while to figure out that the dental part is actually where I belong to because I never wanted to become a dentist. My dad is a dentist, and we had to do civil service in Germany when I was about 19 years old, right after school, and I didn't know what I wanted to do. I was just like trying to become a professional skateboarder, doing lots of sports, and but I wanted to be. I was doing a paramedic. Is it correct? Paramedic at civil service, and
Hmm.
you have an internship in the clinic, and they just put me into dental clinic. And even if I was only a civil servant, I was able to extract teeth because I think, in retrospect, the doctor there thought I was a student. So I
Hmm.
took like a lot of teeth, and it looked like a really great job, and I was very good with my manual labor, anyways. So I just applied to dental school without knowing anything. So I didn't know that dentistry, you need to know chemics or physics or any sort of sciences. I was just like, oh, okay, that seems to be a good thing. I just apply and start doing it. But I was always very interested in my own health. And before university, even, as I said, I wanted to become very good in sports. But I was always yeah, a little bit sick, you can say. I was very athletic, but I had recurrent throat infections, lots of things, tons of antibiotics, like the regular medical stuff. And yeah, so I was searching for, yeah, uh, how I can get my body healthy. And
Right.
I was doing this already while I was studying dentistry. So I started basically with nutrition and physical exercise when I was 20 years old and was very much interested in the nutritional part and did all these things kind of like parallel to university where you have to study chemistry, biochemistry, physics, and all kind of connected just on a personal level for me. So I wasn't thinking outside of the box. I was just doing the studying. And conventional dentistry is basically about repairing teeth. You have a hole in it, you need a filling. That you need a root canal. If there's a lot of material missing, you need a crown. All these things, but I wasn't connecting it. And after university, when I was I had to do an assistancy before you become before you can open your office. You need 2 years at a clinic, and I was very fortunate to learn from a very good surgeon because I wanted to start surgery from scratch, like implant surgeries and oral surgery. And he was doing amalgam fillings. And I was very, aesthetic and of course performance and nutrition and aesthetically driven. I could also not place I would say an ugly silver or metal filling in the mouth of a patient. And I knew from my dad that he wasn't doing amalgam fillings for the last 20 years. I had learned in school how the amalgam fillings are working and that they are basically fine from a biting point of view. They last forever, they're cheap, they are subsidized by the insurance. But I couldn't do it. So I told my boss, no, I can't do amalgam fillings. And this is basically when the whole universe in terms of health optimization opened for me. So my learnings for me personally in terms of performance, nutrition, aesthetics, and health optimizing me, plus then the conventional part with the amalgam opened the field of heavy metals to me, functional medicine. I learned from Dietrich Klinghardt. I did the functional medicine course back in 2011. I basically went to courses to learn different approaches. The first 4 or 5 years just was to search because I didn't like only doing the dentistry part. I wasn't sure what I'm going to do, but I knew it's going to be something with the overall body, and amalgam was kind of like the holy grail at the beginning. This led me to the problems with the root canals, led me to cavitations, led me to all sorts of things, intravenous nutrition and neurotherapy. I'm also a naturopathic doctor, which I did all these certificates basically to learn stuff for myself. And now it's like 15 years later and I can give it all back and have a full concept and basically biological dentistry 2.0. And it's it's going very well and we can help lots of people here. And this is why I'm doing all these podcasts and books, just to spread information, because this is still something you don't learn in university, unfortunately.
Yeah, that is true, and I'm glad that you made some of these revelations because like I would imagine that most like it's very common even for like regular doctors to not have the holistic approach or not understand how intertwined and interconnected everything else is in the body. So I would imagine that it's not an exception amongst the dentists either, like the traditional dentists. So they are pretty like maybe they don't yet take into account how the oral health is affected by like other systems in your body and vice versa.
Yes, the problem is that university, you most of the time just get trained to repair things. It's kind of like a garage where you just bring in your car and then there's a dent, you need a filling and whatever. And the main goal is just lighting and aesthetics. So it has to look good, you can bite on it, but that's basically it. And in a nutshell, and it's not, it's really outside of the box thinking. You would always call it, it was called holistic dentistry. It is still holistic dentistry. It should be called holistic medicine, and dentistry should just be a part of it. And as I told you, I've done the functional medicine courses years ago, and even all the functional medicine doctors I'm meeting right now, and I call them the wolves, and they are still not really looking into your mouth in terms of your overall body perspective, even if everything starts there. So this is basically the mission here, showing that this is a part that needs to be dealt with in kind of like a foundational overall health optimization protocol.
Yeah. So maybe let's talk about how does the mouth affect, the rest of the body and your health? Like, why would you like, make a book about that health starts in your mouth in the first place?
It wasn't my idea to write a book. It was like, because of all these inquiries and being specialized, I did these YouTube videos because all my patients are reading just remotely. And somebody was very interested in these videos and just asked me, wow, this is something new. You want to write a book? So this is how it came across. And my only thought was, this is something where I could bring the information to lots of people, because the goal is help as many as possible. And so I just signed and said, okay, let's do the book. I didn't think about how much time it will cost me, but I'm now very happy actually that I did it, because it kind of like, it came out in 2019 in Germany, and now it's already in English, it's in French, it's in Estonian. It's just That's crazy, right?
Yeah.
In Czech, in Chinese, and this is all coming from these different countries. So I cannot, because I'm not self-published, I cannot just translate. It's all going through. So basically, I just have this strong urge or passion to show everybody that the mouth is basically part of your body. But basically, that's it, and that you maybe have to look for different approaches nowadays, because in this world, the epidemic is chronic disease, has to do with your immune system. This is something we learned in the last half year. I think the whole world knows now about the word immune system, but before I think it wasn't so clear. Corona is going on, and about inflammation, which is also, of course, because of your immune system, toxicity, and basically what you could do differently. Because from a craftsman point of view, of course, it's fine to have maybe an amalgam filling in your mouth because you can bite on it. It's also good to have a root canal because you can bite on it. And maybe you can have all sorts of different materials in your mouth and you can bite on it, but they can have, on a 3-dimensional X-ray, you can have huge inflammations, chronic cysts, chronic ongoing cytokines like the innate immune system cytokines like TNF-alpha, interleukin 1. All these things that are disrupting your whole immune system and nervous system. And yeah, I learned from very good people like Dietrich Klinger, Thomas Rau, and they all say that about 70% of all chronic disease, it's just an estimation, starts in your mouth because of the disruption. Because teeth are not just hard biting instruments, or like your hair. Teeth are organs, and you have 32 organs standing on one of the most important cranial nerves, which is called the trigeminal nerve. And if you know that this trigeminal nerve can transport all toxins, viruses, bacteria, parasites, and whatever into your brainstem, it's called retrograde axonal transport. And if you have a little bit of an idea about your autonomic nervous system, you will know that your ganglia and your all other brain nerves, and also the nervus vagus, which is parasympathetic nerve, is totally connected. So you can see how all these teeth are intertwined with your whole nervous system, and of course with your whole organs in your body, like everywhere. There's actually even a chart for it in the book.
Wow. Yeah, that's that's quite phenomenal. And yeah, like most people wouldn't ever think about, like I haven't thought about like teeth being separate organs, I myself either. But I do know that like the adipose tissue or the muscle tissue acts like an endocrine organ, and it controls like also like the levels of inflammation and oxidative stress in the body. So maybe like a bad oral health can also resemble like this visceral fat or excessive body fat, where you are constantly secreting these pro-inflammatory cytokines and other pro-inflammatory markers into your bloodstream on a chronically basis. And like I said, like these amalgams or metal fillings, they are just like stimulating the nervous system in this disruptive way, and that's where disease will originate from as well, because your body is constantly and chronically inflamed by it.
Yes, yeah, totally correct. So yeah, exactly. It's basically totally the same, just another part in your body. It's not the fat tissue or the muscle tissue. It's just like the nervous system and everything else too. Because let's go with the metal. Yeah, a metal in your body. Let's say everywhere. It could also be a titanium screw in your arm. But most of the time, you have metals in your mouth just for biting, and different ones. And you can see a few points here. So metal can be just toxic, like mercury. Mercury is the most toxic non-radioactive element known to man. So I don't think it needs to be in your body.
Mm-hmm.
The amalgam is still the main source of mercury toxicity in the world and in your body. Also, there's gold, titanium, all these other metals don't have any structural component for your body. Then you can have an immune problem because you could be allergic to everything. And for example, everybody knows that nickel is that a lot of people are allergic to nickel, but there are studies showing that if you get the immune system in contact with inorganic or organic mercury, you can get allergic to it. And even gold is very, very highly allergic under lymphocyte transformation test in the blood, which was done by loads of patients in a clinical study. And also, besides the immune system and the neurological problem and the toxicity, nowadays you have EMF, you have Wi-Fi, electromagnetic fields, and it's pretty clear that if you have any metal in your body, that you have kind of like a little antenna. And also all these antennas oscillate at specific frequencies or wavelengths. And there are studies showing, for example, if you do a phone call on your cell phone, normally the electromagnetic fields go to your cell phone and back to the tower. If you have any metal, it could also be a piercing in your nose, but let's say you have an amalgam filling in your mouth, it will, there's studies showing that you have more mercury vapor coming out of the filling because of the higher frequency. It's kind of amplifying the whole electromagnetic wave in your mouth. Imagine there would be like an antenna in there, so the wave comes and it does like this in all directions. And if you know that your nervous system also and your cell has a, you can just think a bit further and see that this will disrupt your whole nervous system and your whole currents in your body, bringing you into electrosensitivity. And I have loads of patients with electrosensitivity on a daily basis. There's even like a whole problem.
Yeah, wow. Yeah, that's a really crazy thing to think about, that if you have like a lot of metal in your mouth or any parts of your body, like in a joint or somewhere, then it's a pretty, makes you like a huge antenna, or at least like a mini cell tower that attracts these frequencies much easier.
Yes, I've done one post on Instagram where I said, if you still can't sleep or have any chronic issues, despite doing all the biohacks, it's time to look in your mouth, because maybe this is disrupting everything. That's why you have to start there. This is where everything begins. So basically, what goes into your mouth, like nutrition is a big part of the equation, and what has to be taken out. So the metal, the root canals are another thing. Root canals, you know about root canals? Those are basically teeth. You had a huge cavity and you had pain, massive pain in your body. The dentist needs to do anything against the pain, and the pain treatment is basically a root canal. And you basically take out the nervous system, the blood supply, the lymph supply of the tooth, and leave it there as this hard organ, but without any connection to your body. Fill in some plastics, rinse it a little bit and disinfect it, and leave it there as a, you could say, as a dead organ. And this is something that has a few hidden hazards, can have a few hidden hazards, because in the regular world, in a regular natural environment, this tooth will probably have an infection and there will be pus, and then your body will just extract it by itself because it's just inflamed. But you keep it in there, again, it's the perfect cave because of the structure component. A tooth has like millions and millions of tiny little dentin tubules, which are the perfect cave for microorganisms that are anyways living in your body. So anaerobic bacteria are not bad in itself, but if you compartmentalize them into, for example, a dead root canal or dead tooth, they can live and flourish there without the immune system being able to eat them or attack them, because basically macrophages just present to the immune system. You can see kind of like the bacteria lurking inside the dentin tubules, and the bigger macrophages around making a chronic inflammation, which you can see on an X-ray, for example, as a cyst or as a huge cyst or some pus that's coming out. And imagine this for 10 years, 20 years, 30 years, ongoing chronic cytokines. You know the studies, yeah? You can look at IL-6, it will interfere with your growth hormone, it will interfere with basically all functions in your body. It will make your cell insulin resistant. It can make havoc on your neurotransmitters. So actually everything that you know from nutrition, ketosis, and hormesis, you can totally do the same knowledge and apply it to the mouth, but nobody looks there. And this is where I have to come in and fill in the gap, because I've learned all the other parts too. And mutual friend Tim, I like. You've been to the Health Optimization Summit. I've seen it last year. We didn't meet. But I like that he calls it health optimization. I like also the word biohacking, but I didn't know what it was until like 1.5 years ago. So health optimization starts in your mouth, and it's a big part. And I think in the future, all of us, doctors or coaches, should have kind of like a concept of how overall health works. And you maybe need a specialist in the field, like, okay, there's something to repair, send it to maybe me or any other doctor who's able to remove the cells. But the mindset should be, for at least for our future generation, like my kids, you don't need a dentist. because your body initially is immune against cavity. It's immune against scoliosis and bad problems. It all starts with your nutrition and with your lifestyle.
Mm-hmm.
And if you can teach this, you don't have any root canals later. You don't need any fillings, and we wouldn't have all these problems. But this is not now. Now it's more like chronic epidemic of chronic disease, and loads of people that are having all these problems. Metals, we had root canals, bacteria in the root canals, infections, the toxins, thyroid eaters, mercaptanes. And then there's also one thing, you get to call it a hidden health hazard in your mouth. It's called cavitations as a layman's term. Cavitations are better known as NICO or FDOJ, fatty degenerative osteonecrotic jawbone. This is stuff that you don't learn in university,
right.
But I see this on a daily basis. And this is just insane. Yeah? Imagine mushy, fatty, necrotic bone in your jaw, surrounding your trigeminal nerve with all these inflammatory cytokines, chemokines in there. You want me to dig deeper? Just let me know. This is something that the world really needs to know about. So it's kind of like getting belittled, even if it's like lots of studies out there for this.
Yeah, definitely. And why do you think that there isn't that much understanding about this important connection? And also what is some of maybe the potential controversy around it? Like why isn't this thing being taught in schools?
You mean the cavitations?
Well, everything related to amalgams and the teeth and oral health in general.
I think it's just this multiple factors. Of course, it's not always the goal of optimal health is not actually the goal for medicine. It's like, medicine is more like health is defined as absence of disease and not for optimal health. And the dental part is more like, until last year, the approbation, so the stuff that you have to learn in university was from 1954. So we learned things that came from being a dentista. So a dentist 100 years ago wasn't a doctor, wasn't a medical doctor, was just a pure craftsman. And this is why I always say the next level is high-tech craftsman or high-tech dentistry, but melting it down with functional medicine and health optimization. This is the part that's just not trained in university, because I would say the stuff you learn is 50 years outdated. And as you know, everything in university or in clinics just takes forever. So my approach is the other route. It is to inform patients and people that might have any problems, and that there are solutions, and that you maybe have to start in your mouth. And then the patients are asking their doctors, hey, have you heard about biological dentistry? What about ceramic implants? I've heard that there are solutions, better things than metals nowadays. And then the dentist has to double think. So I'm doing this for 10 years at least, and I've done so many congresses and speakings in front of regular dental communities, and this was always a pain in the ass. So because of being emotionally attacked. So this is, if you're not open-minded, it's really difficult, but it changes ever since last year. It's kind of like there's a new breed of people like me, like I call them the cool kid biohacking dentists, that are finally seeing, okay, we are good with the technique. This is something that is fun, and it's a very skilled approach. Even a root canal treatment is very highly skilled stuff. So I admire people who can do this, but our thing is just like, what can you do to optimize health? And this is, you can still do your dental stuff, but you have to learn about your immune system. You have to learn about nutrition. You have to learn about detoxification. You just have to get more updates, kind of like an iPhone 11 now. You cannot communicate with iPhone 11 and the apps of an iPhone 6 doesn't work anymore. So it's just basically missing information, and it won't work in university. We are doing research right now for ceramic implants with a few universities in Tübingen and in Hamburg. So we are starting research, but research always comes last. You always have to see and then change things and go with your gut feeling, and maybe do things that are not like taught in university, just because you want to help a patient getting healthy. And there is actually all the research, but it's maybe from microbiology. It might be from let's say, biochemistry, yeah, like amalgam fillings are still subsidized in Germany and still in the US. I don't know about Estonia, but Scandinavian countries like Sweden and Norway have banned amalgam and all heavy metals at least, I would say at least 10 to 15 years ago. So they just have an overall environmental heavy metal ban, so they couldn't do the amalgam in the mouth. But in Germany, it's still subsidized. So that means insurances pay for amalgam fillings, which is just insane because the studies are from the 80s.
Yeah, and I've heard about this Netflix documentary as well, Root Cause, I believe, and that was like banned as well because of covering this controversial topic of amalgam fillings and metals in the mouth. So, can you maybe explain what was the controversy about and what's the reason?
Yeah, Root Cause was, I think they banned it mid-19, and I was actually promoting it quite a bit because I knew the people in there. Root Cause is a documentary, it was on Netflix about a guy who basically biohacked everything he could, but he still wasn't fit. So he tried everything, including shamanism. So he went every route, esoteric, and I have nothing against esoteric, don't get me wrong. Just he tried everything. He must have been a superhero, but he wasn't. So then he came into a dental office in a holistic or biological one, and they just found a root canal in here in the front. And the incisor is connected to your kidney and bladder meridian system from Chinese medicine, and it draws, of course, a lot of energy. They just removed the root canal, and basically all his problems were gone. And of course, it was just a documentary, and probably not as research-based, but a little bit more Netflix style, of course. And what they did, my colleagues, basically, the guys that are specializing in doing root canal treatments, they are called endodontologists. They only do root canal treatment. And of course, they do that very well, and that's their job. I think 200,000 endodontologists in the US signed a petition to remove it from Netflix. You can still find it, I think, on Amazon, maybe on iTunes. But I had a lot of patients coming in or seen this movie, Root Cause, and I couldn't believe that my colleagues they just don't get it. And this is still a fight that's going on their side, because I basically don't fight. I've written an article about root to disease in 2013 here in Germany, and I wanted to publish it everywhere, and all the magazines told me that's not possible. One accepted it, started online, and it was the most read article ever back then on the online page. And then we printed it in the Dental Tribune, Endodontic Tribune. So I had lots of problems with my dental colleagues always, and it's still going on because they initially, when they don't know, and somebody like me presents it, they think I'm a marketing guy or something. Right. They don't know my passion. They just see this dude in Instagram who's saying that root canals might be a problem for your overall health. They don't even read what's in the caption, or they don't even look at the video. They just think this guy he's just not telling the truth. And then they initially go into protection mode, anger, denial, and then just massively attack you. And of course, when my book came out, there was also shitstorm and everything, which is fine, because if they're a little bit open-minded and they meet me in person, they will know it's just my passion. I need to just inform. I don't say anything. I never tell people that something is dangerous. Actually, quite the opposite. I just inform that if you have any problems and you can't get fitter or healthier, dude, maybe you have to look in your mouth. And why should it be a problem for a dentist? We dentists, we are always being belittled in every movie, like Hangover. This dude is not a real doctor. It's just a dentist. He doesn't know anything. That's what a dentist is all about. So normally when you're a dentist, most people hate to go to the dentist. Let's be honest. They're like, oh, it's going to be painful, or maybe they find a hole, they have to drill, or maybe a root canal. So everybody hates the dentist. We have to deal with bad, negative vibes every day as a regular dentist. My patients wait for months and months and prepare themselves with their nutrition, with their lifestyle, and look forward to go to a health optimization week. So I have fun every day. And I think all the dentists would profit from this. So they have a better life. They help the patients. They can do their high-tech dentistry, but they have to learn a bit more about immune system, nutrition. You should always start with themselves. That's how we train, actually, and make them healthier. And there's a whole health matrix behind all this. And basically, biological dentistry And removing all these things is a big part of the health matrix. So removing the source is key. You can have your lifestyle, you can check all the things you're also talking about. Yeah, sleep optimized. What about you have your sleep optimized? You're wearing the red glasses. Yeah, you have your Wi-Fi switched off. You eat perfect. You may be being in a ketosis, or maybe you're doing metabolic flexibility eating, or whatever. You go grounding. You do recovery tools, IV, hyperbaric, but you still lack deep sleep, and your heart rate is at 75 at night, and your variability never goes above 22. Even if you've done everything, it's time to find somebody who is able to look in your mouth and diagnose this, because this is the start and the elongation of your brain. Maybe you understand?
Yeah, absolutely. Like, it's requires this sort of understanding about how the teeth are connected to the various organs, like you mentioned, like the brain and the kidneys and liver and so on. So yeah, it's a kind of a mindset shift, or like just getting the right information. And then like it is true that if nothing else seems to be working, or that you have been doing everything right, then maybe maybe you have like some fillings that need to be removed or something. So what would be like maybe some signs of that they do have that kind of issue, or is it like that everyone should try to remove all the metal and all the fillings from the mouth no matter what?
When your goal is optimal health, 100% yes. You cannot tolerate in this environment nowadays, which is anyways difficult to live in. Having heavy metals anywhere in your body, or metals in your body, is just not acceptable. Root canals can be problematic if you have chronic infection or chronic inflammation. You don't want to have a chronic inflammation in your body, right?
Right.
And also these cavitations where you find chemokines like antis, which is basically telling your body to heal itself all the time, and is connected to all sorts of medical diseases. Like, just PubMed this chemokine rantis, or CCL5, and any sort of disease, let's say chemokine rantis plus multiple sclerosis, you will probably find 2,000 papers right away. The only medical field that doesn't look at this is the dentist, who actually produces it, or even could diagnose it if he knows about it, but you don't learn it. So the typical things for these cavitations is chronic, being chronic tired, or was it chronic fatigue?
Yeah.
Chronic fatigue is number one. Thyroid problems, number one. Hashimoto's, autoimmune thyroiditis, and irritable bowel syndrome, because the cavitation in the wisdom tooth area, where it mostly happens after getting your wisdom teeth removed, is connected to your small intestine and heart meridian, as well as your adrenal glands, and this is where the whole autonomic nervous system switches. Lots of grinding. Bad skin is always related to small intestine. So me personally, I had bad skin and intestinal problems, done the cavitations, and was just gone within 1 day. And of course, we have a lot of chronic sick patients with like ALS, MS, multiple sclerosis. And this is basically what it was the last 8 to 10 years, more like chronic sick patients, like that I have seen 29 doctors before. But it's changing to more health optimization patients that are just looking for the next edge. They're already an 8 out of 10, but they're looking for maybe improving the sleep, getting healthier. Like our friend Tim, yeah, he also went to see me, and we did a lot of, we still, even if he's as healthy already, there was a lot of things to find in his mouth. And the funny thing is that his career started with amalgam toxicity. And amalgam is always a problem because you have mercury once in your mouth. There's so many studies showing that it will do a dysbiosis, because mercury basically kills the good bacteria, not just in your mouth, but also in your gut. Swallow it. Mercury also goes into your cell, blocks your nervous system. It's related to all nervous system problems. And it's also going within 24 hours. It goes through your tooth, through the dentin tubules, in your whole jawbone, basically impregnates, or basically sticks into your bone, makes havoc with your bone metabolism, and is in your whole body, mainly in detoxification organs like the kidney, also in the brain, and whatever fatty tissue in 24 hours. And it stays there, depending on your genetics or your SNPs, for 16 years, for 30 years, or you cannot even excrete it at all. If you have any apolipoprotein problems and you have it in your nervous system, it's quite difficult to get it out there. So I think no-brainer to have your mouth as clean as possible. It should be foundational work of all us coaches, besides the treatment.
Yeah.
The other
yeah. So like with the mercury, it's that the longer the mercury stays in your mouth, then the more of that mercury is going to spread throughout the rest of the body as well, because of like it constantly being leached into the bloodstream, if that's right.
Different mechanisms. So a mercury filling is basically just, it's not really an alloy, it's more like a mash of different heavy metals, 50% being mercury in the amalgam. And if you, for example, bite on these teeth, grind, you chew, you brush, you go to professional cleanings, there's always more mercury vapor, which is Hg0 in chemical terms. And Hg0 is vapor, it's odorless, you don't smell it, you don't see it, and it goes through all cell membranes without any protection. And then in the cell, it's probably being oxidized by catalases and built into Hg2+, and sticks there. So it's really mandatory. And of course, if you have an amalgam filling for 10 years, for 20 years, for 30 years, of course, you're chronically intoxicating your body even further, because it's about 2 to 3 micrograms of mercury vapor leaching out of one filling. If you have, for example, an amalgam filling right next to a gold crown or next to titanium implant, so different metals, you also have a problem called galvanics, which is battery. And you have the saliva, which is an electrolyte, and then kind of like in a battery, the anodes travel to the cathode, you know what I mean? Like the ions. So you basically corrode. Imagine a propeller of a boat underneath the water, how it's getting rusty over time. That's corrosion. Same happens in your mouth if you have different materials. And if you have a titanium implant, which is basically a root alternative for root canal to your tooth, and you put a gold crown on top, you can measure voltages up to 3.5, which is a real battery in your jaw, in your nervous system. It's just insane. And if you think of all these implications. So if you know all these things, in my opinion, it's a moral obligation to tell people, and of course you have to decide yourself, but it seems to be a no-brainer. At least
yeah, fortunate I haven't had like any fillings or like any teeth problem in the past, so I wouldn't I wouldn't be like I can probably I would probably be able to recognize that if something is off, then there is some problem there, and maybe like some biomarkers people can look out for is like just this increase inflammation and sleeping problems and detoxification problems and all kinds of like autoimmune related problems.
Yes, basically you cannot pinpoint it to any symptom, but if you have any symptom, it could be related to a heavy metal problem, could be related to a root canal. This is how you have to approach it. You will find studies for all of it. But have you personally had your wisdom teeth removed, or have you had them in your mouth?
I think I have them. I haven't had them removed, I think. Because I don't remember having any of my teeth removed or something.
Yeah, you would remember. But do you know if you have all teeth in line? So do you have 3 molars?
Yeah, I think so, yeah.
That's good. That's a rare thing, at least in Germany or most Western countries, actually. So if you have your wisdom tooth and they're in line with all the teeth, that's actually perfect. But I would say 80% of all patients get their wisdom teeth removed in Germany or in the US, and let's just say in the Western world, because of crowded teeth, spacing problems, or have impacted wisdom teeth. By that I mean you don't see them in your mouth, but on an X-ray you would see them being in the jawbone, which is a huge problem, like a cavitation. And the same thing, your body wants to push out the teeth, it's just not possible. It does a chronic inflammation around it, your nervous system being stressed, and in sympathetic nervous system, fight and flight basically 24/7. Imagine you in 24/7 in fight and flight. How is your body working? How is your digestion working? How is your sleep? This is basically what I see on a daily basis.
Yeah. The worst thing is that your body gets used to it, or like your psychology gets used to it. So you think it's normal to be like agitated and stressed out, whereas in reality it's just your body and brain getting habituated with it.
Yeah, that's kind of like your body being lazy. Chronic stuff is lazy stuff because it hurts maybe for a bit, but then the receptor just gets downregulated. You get used to it, and you never know. Add lots of these chronic problems. I always train my patients while doing surgery, focus on the breathing and focus on not thinking and feeling your body, because if you remove all these things, the body knows within a second that it's healthier. So most of the patients get into parasympathetic mode while doing surgery, while removing the crap, and feel lots of things like getting finally warm hands, warm feet, and see better, all like crazy symptoms if you can really feel. But a lot of them are like 30 years in chronic stress. They don't feel anything anymore. They're kind of like machines used to this. So then it's really weird that something is actually
yeah. But what would be like some alternatives? You mentioned some of these ceramics as alternatives to amalgams.
So amalgam fillings, I actually don't know if that's the alternative to just an amalgam filling. Is you just go with a composite filling, or you do a classic numeric filling. It's depending on size and shape of your cavity to repair, but I would just go with something more biocompatible like ceramics. So you could do composites for tinier ones, and ceramics for, let's say you need an inlay, like just a bigger cavity or a partial crown or crown. This is just dental tongue for like medical stuff, for like how much of the enamel of the hard substance is already been destroyed. So if it's a lot, you maybe need a partial crown. If it's the full tooth, you need a full crown or a cap sometimes then. But go with ceramics because those are made out of sand basically. So that is most biocompatible. If you need an alternative for root canal, so the root canal comes out, 99% of all dentists still do titanium implants. Titanium is obviously a metal, and it is biocompatible, but of course it's not neutral. So it's not as biocompatible, and there are lots of studies showing that it's still healing or osseointegrating with an innate inflammation. Again, TNF-alpha, interleukin-1, IL-6, NF-kappa-B on an ongoing basis. Besides being an antenna. So I'm a specialist for ceramic implants. I remove all root canals and I place immediate ceramic implants. Why? Because ceramic is totally neutral. I'm not saying that ceramic implants is the best you could possibly have, because the best is still your regular healthy tooth. But it is a good alternative if you need reparation. And an immediate one has a bigger implication because we can remove the root canal. Let's say you have this tooth. You can take it out very carefully. I will clean everything with ozone and neural therapy, and then you just insert the ceramic implant at the same time. The ceramic implant in this case acts like a tent pole, stabilizing your whole anatomy. So your body is healing on top of the ceramic implants because there's no interference from the material. So we need to check the materials. And I don't know if the future brings something else. I'm currently the president of the International Society for Metal-Free Implantology. We actually called it metal-free because you never know if there's something better, but it's at least a solution for people that need reparation. So removing a canal and implanting something at the same time with a material that is neutral, biocompatible, and body likes it. Good strategy, I'd say.
Yeah, I agree that the best strategy is the prevention, or making sure that you don't have broken teeth. But that's not possible for people who have been doing the wrong things for decades and for long years. But what would be like the best ways to just keep your teeth and oral health healthy, without any like intervention?
It's basically your lifestyle. That's nutrition right from the start. Your tooth can mineralize itself and does mineralize itself through the saliva, and also builds up, of course, through the nutrients that you have in your blood or in your body because of the stuff that you absorb. And this is why nutrition has such a big impact, not just for me and my body and physical exercise and all these things, but also for all the purposes of osseointegration of ceramic implants, healing these cavitations. So because when I clean the bone, I need new bone there later on. If your body wasn't able to build bone after removal of a wisdom tooth in the first place, we have to make sure that when we do this again, that it heals. So in my nutritional approach is called food design concept. It's basically 20 years of nutrition into as easy as possible. I think we both placed in all the same stuff, like as natural as possible, focus on whole foods. It's basically, in my concept, is a red chart for patients, very simple, stuff that you shouldn't eat. The core four is always, sugar. Every dentist should know sugar, and every patient knows sugar is not as good. It's not so good for your tooth. We go with grain-free or at least gluten-free grains, dairy-free most of the time. No butter is allowed, of course, or ghee. And highly refined vegetable oils should be avoided because of inflammatory problems. And we focus on a green chart, which is macronutrients, protein, healthy fats, healthy carbs, veggies. And I basically just individualize it within 5 minutes after knowing what they do after surgery. And before they come to surgery, they start just with a generalized approach for at least 4 to 6 weeks, from macro to micro. So we go with recommendations like at least 2 grams of protein per kilogram of body weight, and enzymes, so that your body is able to build bone and tissue. Just in this case, you have to be anabolic. See it as a surgical phase. We will remodel your whole house. You need workers. You shouldn't be into any sort of hormetic stressor besides the surgery. So the rest should be building blocks, building blocks, building blocks. I fine-tune depending on their metabolism, which energy sources they should use. All people have different sorts of mindset. They can be a vegan, they could be a ketogenic guy, they could be a vegan, they could be metabolic flexing, they do intermittent fasting. So because it's based on macronutrients, I can design it independent of all mindsets, just with the goal of being anabolic, actually, in this case, and to recover and regenerate for at least the next 3 to 6 months until all the stuff that I did surgery for are ossified or even osteointegrated, and your body will profit from this, because most of the patients actually are catabolic for long years or being in sympathetic nervous system. So even if they come in and doing only 1 meal a day for the last years, I will probably do the opposite and just let them eat and get out of stress mode by implementing right strategies. It's all the toolbox for me. Basically, I can do it probably too. Using the tools, and of course then fine-tuning with the micronutrients. I've invented a protocol. It's called the bone healing protocol. It's evolving around 20,000 IUs of vitamin D3 a day, 4 weeks prior to surgery, to get you at 70 nanogram per milliliter before surgery or health optimization week, and then stay there forever. And at least for a few months, you need these 20,000 IUs. But of course, you cannot just smash 20,000 IUs of vitamin D3. This is why it's a full protocol with all cofactors, magnesium, vitamin K2, omega-3, vitamin A, like the full package, and activated vitamins, so that I'm sure at least for these 4 to 6 months, they are as healthy and as anabolic as possible. And most of the patients actually, they stick to these things, get a bit more individualized, maybe do a little bit more of other mindsets too, but the most impact is the lifestyle. Of course, I have to remove the source. I use all strategies in terms of recovery, hyperbaric, intravenous nutrition is always 2 days before, on day of surgery, after surgery. We draw blood to make PRF membranes, which contain stem cells, peptides, red light therapy, infrared sauna is going to be there soon. Like all things biohacking, health optimization are anyways included, but to make a full picture and the people get into a healing mode, and then we help the body to heal itself, because this is what we do. The body is intelligent in itself, but if it's depleted, it's not possible. If there's stuff that's disturbing, we have to take out the source, basically. And then your body can heal itself. We just support. That's it.
Yeah, it's I think the biggest culprit is just the processed food, the inflammatory processed food, and especially like the sugars and other vegetable oils and those things. I'm sure that you heard about Western Price, who was wondering why did the Aboriginal tribes have very little cases of tooth decay and cavities compared to like the Westerners, and he found that it had to do just with the diet, that the hunter-gatherers, they ate their natural diet without any processed foods, and the Westerners just ate a bunch of crap, and that's why they developed bad teeth.
Yes, Westphal is actually one of my role models. I would say he's one of the first biological dentists and explorer, because he did both nutrition and being a dentist. Yeah, he did also lots of studies about root canals. I don't know if you know about this. He has written a book, Nutrition and Physical Degeneration, I'm probably referring to. And but he also did 30 years of root canals. And what he did, he did the most insane experiments, because he was just seeing patients that are getting sick, chronic problems. And he didn't know, but he told them, I'm quite sure it's coming from these root canals. Let's just remove them. And what he did, he just removed the root canal teeth and implanted it under the skin of rabbits. Famous rabbit experiments. And the rabbit just transferred about 80% of all the symptoms and got the same as the host with heart problems, 100%. And he did that for 30 years. And he has written a huge compendium, and one of the other godfathers of biological dentistry, Dr. Hal Huggins, he did the whole testings again in the 70s. Same results. Still nobody knows about it. And because it's, of course, also the endodontologists, the dentists that are trained to do only root canals, and it's also, of course, their business. And it's actually the biggest group of dentists growing in the years of like 30 to 45 years. It's not like me, I'm a surgeon. This is in the 10% of all dentists that are anyways doing surgeries, ceramic implant surgeries, like a handful of people all over the world. So it's really endodontologists. And this is what he said, like 100 years ago, famous rabbit studies. Google this. And of course, the Aborigines, what he also did, he gave the Aborigines he looked at Aborigines or Western Africans who had the ancestral diet and had like all wisdom teeth in place, wide nostrils, not mouth breathing, nose breathing, and like perfect posture, very healthy. And their younger relatives, like their kids, had in contact to process foods like sugars, all the stuff that started then, like sugars and milk and whatever. And what they looked like monsters, like little monsters, crowded teeth, mouth breathing, no wisdom teeth, no space for wisdom teeth, narrow faces, and like scoliosis. And he just postulated that it is because of nutrient depletion. This is where also he did kind of like an initial bone healing protocol, because he found this activator X in the milk, in the grass-fed butter, and like the milk and the butter from grass-fed cows. He said something in it. And Chris Masterjohn actually found out 2009 that this is vitamin K2. Of course, vitamin K2 is always a big part of bone healing. But if you eat an ancestral diet, vitamin K2 is the vitamin K from animal food. But lots of people nowadays eat vegan stuff. There is no vitamin K2 in plants, only in natto, which is fermented soy. We have our K2 from this source, but it's pretty difficult. So most carnivores will probably have no problem with K2 deficiency, but or like omnivores are meant. But vegans have a lot of deficiencies, and they are mostly catabolic when they don't know how to do it for optimal health. This is where I have to come in, like protein deficiency, lack of choline, B12 is clear, but creatine, taurine, carnosine. From a medical point of view, you have to really then optimize it to make sure that they really osseointegrate the bone, because they most of the time are not able to build tissue. They're just catabolic.
Yeah, it requires more kind of attention to detail, or just awareness about the nutrients that you need and how to kind of supplement them the right way. So like you can still get, like for K2, like natto is actually the #1 source of K2 in the world. It's just that no one is eating it. It's only like in Japanese dishes and Asian countries where people tend to eat it, and most people in the West don't eat it. So yeah.
And they don't even know about it. And the problem is, I looked for it. It's really difficult to get an organic source of natto, and it doesn't taste so good actually.
Yeah.
Most of the natto you find in Chinese supermarkets are full of MSG and like.
Yeah.
This is not healthy.
Yeah, you would have to do it yourself if you are really concerned.
No problem. Actually, it's the same thing. If you want to do a vegan diet and plant-based, then you have to know how to treat plants the right way. And like our ancestors did, you have to ferment the stuff, you have to soak it, you have to maybe wash it longer. Yeah, like gluten, for example, if you do sourdough bread, and
Mm.
that's what Germans did.
Yeah.
50 years ago, my grandma did sourdough bread. She just let the dough sit for at least 3 days, and basically the bacteria just eat the gluten, and the lectin is not a problem anymore. So
Mm.
nobody does that. So
Yeah.
it's
Yeah.
always gluten.
Yeah, like the fermented grains are more popular in Europe as well compared to like the States, where literally no one does it, and like that's one of the reasons why people think, at least, that despite people in Europe eating more grains, they have still like this, inflammatory diseases related to gluten consumption than in the States, because we ferment the grains and we don't have a bunch of other ingredients in the bread, so we keep it more like natural and whole food.
I think the biggest problem in the US is that you cannot find even the organic sources of wheat. Is always full of pesticides like glyphosate. Huge
Right.
problem. And did a lot of studies, and my friend Dr. Lechner, I call him the Yoda of cavitations. He's 70 years old already and had 12 published papers on these cavitations. They found everything in the cavitations, kind of like a huge dumping area, found glyphosate in there. They found parasites, viruses, fungi, heavy metal. And big thing for the US listeners, they find mold, and I found a lot of mold in there. So in the US, mold is a huge problem because of housing and all these problems there. And mold tends to live in these cavitations, and it's really nasty. Mold takes lots of energy, and you can't find it. You cannot literally go into the bone without drilling into it and looking for this, and then you can really sometimes find macroscopic mold, like really yellow, nasty stuff. And if you don't find this, these people, their lives really suck because they live in their cars outside of their houses. They cannot sleep. They're tired chronically, but they cannot sleep. So it's like really, mold is a big thing, and Lyme is the other big thing.
Yeah.
This is why normally, if there's no corona, more than 50% of my patients are coming from the US or foreign countries. Now it's different because of corona, of course. We have more German patients, but I think at one point it will open again. And for medical travel, I think it's still fine. Last week there were people from Canada, so I think it's already opening a bit.
Yeah. What about like these acidic beverages? Like soda is bad because of the sugar, but what about like coffee or teas and like alcohol? Maybe how does that affect teeth?
I don't have a problem with coffee if it's not too much, and I think coffee is not too acidic. A big problem that people don't know, besides soda, of course, orange juice is super acidic.
Mm.
And some people actually smash ascorbic acid and just put a spoon into their mouth and just let it kind of like sit there. This will be very bad for your enamel and too acidic. Coke Zero, but this is probably what you refer to as soda, are very acidic. There are probably teas that are acidic too, but I would normally have no problem with the regular herbal teas like green tea or pu'er tea or black tea, or if it's good quality, I think this is no problem. I think you should most of the time drink water, mineralized water, filtered if possible. So we always filter and then remineralize it, and because also that's good for your saliva. What else could be a problem? Yeah, then of course your toothpaste can be a problem because of a lot of these advertised toothpaste for like whitening, teeth whitening. They contain kind of like sand particles, like a grip tape on a skateboard, to just grind down teeth over time. I would look into these and make sure that you don't have any abrasives in a toothpaste. Also, you should check for fluoride-free toothpaste. That's not because of erosion, but it's just a chemical that you should avoid, at least from a biological point of view. And basically, you can do DIY your own toothpaste, or find something that you would eat, because you put it in your mouth. You should not put chemicals in your mouth or anything on your body. It's like your mouth, the skin in your mouth, like the tissue called gingiva, like the gum, is outside body, like this body. Imagine you have a chronic inflammation on your gum, or there's always a little bit of bleeding. Your gum is then opening, and I refer to this as leaky gum. It's the same as leaky gut, because below the gum is your inside body, starting with your bone called periodontium. where your tooth is hanging in there. So you have an opening and a huge Niagara Falls gap for the oral bacteria, which could be kind of like lots of anaerobics that you don't want to have in your cells. So your mouth has to be integral. So a good strategy to help with the tooth, with saliva, and also with gum tissue is oil pulling. And you ever heard about oil pulling?
I've heard of it.
Yeah, oil pulling is basically, I think it's coming from Ayurveda. It's very ancestral. Just use regular coconut oil, because biohackers always use coconut oil or some C8 oil or whatever. And you could spike it up with some herbs. Like I would probably do a little bit of oregano with the coconut oil and a bit of peppermint. You could also do some propolis because of antiviral activity. And just just swish it around in your mouth or pull on it for 5 to 15 minutes and then spit it out. This will help everything. Do it once a day, then brush your teeth once a day, and that's it. I don't recommend flossing, because if you don't know how to use flosses correctly, you most of the time just snap it through your teeth and create little micro cuts, bleed again a little bit. So in nature, you wouldn't use flosses.
Right.
But they have to add a but. If you're optimized, if you're like you or me and your diet is on point, you probably don't even have to brush your teeth at all, because your teeth are clean from food and from the right sources.
Right.
If you a standard American diet, I would probably recommend brushing your teeth twice a day and maybe use a floss. If you have any sort of crown work or metal, all that stuff, it changes. You probably have to floss a bit. But if everything is healthy and natural, your gum grows on top of your teeth. You don't want to rip it off every day. So this is the strategy. You have to time when is the correct way to use it and when not.
Yeah, I would also agree that, if you're like doing the right things and eating a clean diet and everything else optimized, then you don't like necessarily need to be cleaning your teeth that manically as well, and it may be more damaging in a sense if you're just overdoing it, because your microbiome is also like in the mouth, and you don't want to be keeping it like super hygiene and super sterile.
100%. This is the stupidest thing you can do, like oral rinses, like regular ones, and most of the time is alcohol and stuff, kills your microbiome. And this is really bad, because the whole immune system is in there. Like the saliva is kind of like a magic fluid. There's immunoglobulins in there, there are peptides in there. If you, for example, cut your finger, you initially do because your body knows that saliva will glue this kind of like together, and it's anti-inflammatory and antibacterial. It's amazing stuff. And if your diet is correct, your saliva is full of proteins and minerals to replenish the acidic level and the demineralization of your teeth. Because basically, whenever you chew and when there's any sort of pH changes in your mouth because of nutrition, it changes within 30 minutes after eating because of the pH, because of the minerals in the saliva, basically, to make it easy. So it's a buffering system, it's an immune system, and of course it's your digestion. If you prepare your food, or just the thought of your food, you have more saliva, right? Because it's starting to pre-digest in your mouth. There's amylases in there, there's proteases, stuff to pre-digest. That's why you should always focus on biting. Like my grandma told me, bite 30 times every bite. I didn't do it. I was more like the fast eater, but certainly I trained myself to eat very slow and take time for eating and being in a parasympathetic mode, because this in itself activates my whole absorption later on. Besides, of course, eating only healthy stuff. And as I said, I'm not in any type of mindset. It's more like I probably would use, a different mindset for every meal, maybe. So,
right.
For example, I'll probably eat a more high carb meal after my sport, but then probably do a few meals that are ketogenic or low carb or paleo, and then do another one. So it's more like timing. But protein stays consistent, just to have me here. And my fasting, I know you like to fast and ketosis and stuff. I did that long times, and also too long at once, like half a year at once. And this also is a problem again. So you will always have to find, and this is probably my thing over the years, I have to find the balance in everything because I'm a 0 or 100 guy, very extremist.
Yeah.
I was always saying 100 or not at all, but now I have to find balance. So it's not good for me to eat ketosis all the time because then I get metabolic inflexible and have other problems. There's studies showing that if you go too long in ketosis, it can also be aggravate cancer again. Whereas a bit of ketosis is probably the best strategy if you start having a cancer. So all these things are depending on balance, and actually your body, the only thing your body is searching for is homeostasis. Your body is, you can compensate so many things. But why do you want to compensate stressors in your mouth 24/7 if you have solutions to change it? Because you have so much other stuff to compensate in our not unnatural environment that we created within the last 100 years. It's not necessary to have like a Terminator mouth.
Yeah, that's true. Yeah, and totally agree. But last thing I want to touch about is like braces. If someone has like crooked teeth or some, that they want to straighten their teeth or something, would they be beneficial or recommended to do those, even though it has like metals in it?
Of course, your bite is very important. So your bite is basically stabilizing your whole body structure. It's kind of like the thermostat for your whole posture. And also from a psychological point of view, if actually when you have like crooked teeth, it looks nasty, I would always say, okay, it's fine to do braces, but you have to take into consideration that braces are made out of metal, at least the one that are subsidized by the insurance companies. And if you put in a 14-year-old kid or 12-year-old kid with a full mouth of a big antenna, and he's on Wi-Fi the whole day, imagine what will happen while he's just growing up, and it will probably cause a lot of havoc. So there are better strategies. I would start very early, going to see a orthodontist who might work with what's the word in English, with appliances that you can take out, not like the braces. Just to, if you can see with a 6-year-old if they breathe already through their mouth, or if they have like narrow faces, you can start going early to expand the jaw with like these appliances and start with the nutrition. Again, it's the same thing. Start as early as possible. But if you already have crooked teeth, like I had braces twice, I would probably go with a Invisalign treatment, or like these kind of like splints. It looks like a plastic foil you put on top of your teeth. You don't even see it. It's not possible for all say all oral crowdings, because if you have like a bite like this, sometimes you need surgery or you need bigger appliances. But for just regular aesthetics, I would go with the least invasive and metal free if possible. If not, just make sure that your kid knows how to deal with Wi-Fi and all these stuff to be protected, and monitor this kid like tightly if it has any neurological problems or cannot concentrate in school anymore, or is depressed or whatever, could be related to the braces. And also use an osteopath or any sort of manual therapy to help with fascia and all these things moving, so that these braces don't take 2 years, but you can make it within 6 months with the right nutrition, with a good orthodontist, and combining it with manual stuff like osteopathy, myoreflex therapy, fascia stretching, whatever is needed to help growth and stretching in. This is what it basically does. So there are approaches in a biological way, but of course for future generations, the best idea would be breastfeeding for 18 months, no baby bottles, and of course no lack in vitamin D3, no lack in any sort of protein or nutrients, just ancestral food and lots of it. And then also for my kids, at least, that's the strategy I'm doing, because we anyways have that lifestyle. And so far, luckily, my wife is a breastfeeding professional, I would say. She breastfed all my kids for at least 1.5 years, just by intuition, by instinct. There wasn't any thought about it. And for now, they just still have their baby teeth, but you can see they have space. There is no idea of breathing through their mouths. I was a big mouth breather, so they breathe through their noses. It's just normal for them. Perfect space. And let's see what happens. Sometimes maybe I'm lucky and this generation already works. Maybe only the next generation, you never know about epigenetics, but we'll certainly give our best in terms of supplying them with the right nutrients and training them the right lifestyle, because they're only 5, 3, and 1. It's like kids and boys are especially little freaks, you know.
Yeah, and also like chewing, having food that is requires some chewing, because if you're eating like, you know, purees or soft foods all the time, then you don't develop the jaw muscles either. So chewing, like, you know.
Chewing first thing is breastfeeding. Why? Because when you breastfeed, you not just get the microbiome, but sucking on a nipple requires 12 times the strength of sucking on a baby bottle, which trains your whole lower jaw to come forward and get this strong masseter muscles. And also, at the same time, when you're sucking, you have to breathe through your nose, otherwise you die. You can see this with the babies if they get like blocked noses. This like they kind of like die in between. So you can see how nature designed everything. So it's really just
that's really interesting. Yeah.
Because then afterwards, if you start chewing. But this before 1.5 years makes not a big sense. So.
Yeah, for sure. Well, it's been great talking with you, and it's glad that you kind of revealed some of these hidden variables that contribute to person's optimal health. And yes, I think it's really underrated and pretty important to just take care of your mouth and oral health.
Yeah, it's really important. I think this is something that just needs to be one module trained for all our health optimization specialists. And not everybody has to do the surgical part, but if all of us coaches, let's just call us health coaches or health optimizers, just know about these things, we can then see these problems. Say, okay, dude, have you checked your mouth? Or what about your gut? What about your nutrition? And then you have a full concept. And I think this is the future. And this is what I call biological dentistry 2.0. Health starts in your mouth. And I love to spread it. I love to hang with guys like you and other people that are just thinking outside of the box and being able to talk and spread the information. This is really cool about our time, that we can have this reach, because this wasn't possible. Like, let's say 10 years ago, it probably wasn't possible. So it's really a good time, and actually that we have solutions.
Yeah, absolutely. That's awesome. And glad to talk with you as well.
Yeah, I had a lot of fun talking to you.
Yeah. Before I ask my last question, where can people learn more about you and your book and your work?
So the book is called It's All in Your Mouth in English. I have it in Estonian. Wait 1 second. I don't know. I always wanted to know what it stands for. I don't know if you can see. Oh, damn. It's Missus Ses Südames. I don't know.
It means like what's in your mouth is in your heart as well. Something like that. So it's not related to it doesn't mention health. It mentions that something like that there's a connection between your mouth and your heart, basically.
In your heart, but not with your overall health. So they translated it wrong.
Well, it's sort of like a colloquial term or something.
Okay. Yeah, cool. You can find it in the book. There's the whole concept is explained. I'm having an Instagram handle. It's called Dr. DOME1. This is kind of like a health magazine, and I'm trying to post something on a daily basis, more related to health starts in your mouth, but also the whole lifestyle thing. I have a YouTube channel, and of course, we have a website. I think I probably sent you all the show notes, all the things for show notes, probably, if you want to.
Yeah. We'll put all the links in the show notes. And my last question is, what's this one piece of advice or a habit you wish you adopted sooner?
Say it again. One piece of habit
that you wish you adopted sooner.
That I had learned sooner. Yeah, what was one thing that I wish I had learned sooner? Yeah, basically, if somebody would have trained my mindset and how to be able to control your brain and be more able to feel and just feeling and being intuitive and trusting your body, and don't push it too hard at the beginning. That's maybe one thing. And of course, all the oral parts helped me personally extremely for my health, like the cavitation thing. This could have come 10 years earlier. That would be an amazing thing. And yeah, but I'm very happy that I had this kind of health journey for myself, because otherwise I wouldn't have learned this. So I'm the guy, like I said, 100 or 0, because I had my health problems and being depressed or whatever when I was in a young age, yeah, made me find out all these things. And I'm very happy that I can do this. And yeah, start early and train everybody about, nutrition is also something you should start early. If I would have known this when I was 20 or 12, would be amazing, because I was only eating fast foods, like, of course, and alcohol, and party.
Yeah, totally. Yeah, it's never too late to start.
No, of course not. You can start right away, and biohacking is a great way to start, and I love that it's there. Health optimization, biohacking, whatever you want to call it. There are so many things you can do right away without having any kind of money. Just go out in nature, just breathe, go in the sun, all those things we're all talking about. They're basically kind of for free. Of course, you cannot remove stuff from your mouth on your own, but you can start changing your nutrition by yourself, educate yourself, and
Awesome.
Take an epic time, and it's growth mindset, learning a little bit every day, bit of protection. It's all about helping each other, being the wolf pack, and sharing our strengths and build something epic to change, right? Bring change.
Yeah, absolutely. Yeah, that's a good note to end the podcast as well. And thanks for coming. And it's we'll meet each other like in the near future somewhere when this lockdown is over.
I think we will meet. Will you be on the summit?
I think so. Yeah, we'll see like what happens, but I think I will.
When it happens, we will see there 100%. It's in January.
Yeah, sounds good.
I hope this lockdown stuff is soon over, because it's actually stuck.
Right.
All right.
Sounds good.
Siim, epic.
Premiumbeat.com